Okay. So, hi, evening, everybody. And I guess we know each other pretty well. I'm Dr. Sushant Soni, MBBS MAMC, MD Pathology, Resident Hematology, AIIMS Delhi. So, Bache, I know there are few technical changes which have been made to the app, but I guess everybody is able to see and hear me clearly. So this is a joint session between me and Anuradha ma'am, Dr. Anuradha. She is an ophthalmologist currently practicing in PGI. The whole purpose of this session is to give you from the two institutes. I'm from AIIMS, she is from PGI Chandigarh, to give you the thought process with respect to INI, institutes of national importance. Now you very well know that government has introduced the new rule or the new stuff that INI exam will be taking place. INI is Institute of National Importance Common Entrance Test. Institutes of National Importance, Institutes of National Importance Common Entrance Test. Hi, evening, Anuradha ma'am, and pleasure to have you along with me. Are you able to hear and are you able to see the screen, ma'am? Anuradha ma'am. No, ma'am is not. Ma'am is not, I guess. Uh, Ma'am, are you able to hear me or see me? Okay. So, anyways, let us start. Let us start with what is firstly, what does this mean? Institutes of national importance. In this budget, your four main papers, that is AIIMS, that is the AIIMS PGI exam, AIIMS PGI, JIPMER, AIIMS PGI, JIPMER, and NIMHANS have been clubbed together, have been clubbed. Ma'am, are you able to hear and see the slides now?
Yes, hello, good evening, Dr. Sushant, and good evening to everyone who is with us in today's session.
True. I was just giving you an intro and the fact that we are the two educators on board because we are from the two central institutes, AIIMS and PGI. Let's just have a discussion. What examiner will expect out of the student in INI or CT will be asked. Now these which are the four papers which have been combined. Now, Nitya, hi, evening, Bache, most welcome. Now, firstly, is this all four tests they have been combined together? Is it boon or a bane? Is it something positive or negative? It was unexpected. I know it was going on for long that it will be combined. A common entrance test will be there, but the notice period was less. Frankly speaking, we were not expecting this only. We were of the mindset that it will come in 2021, maybe the mid-year 2021 exam will not, it will not be four separate papers. But the government was extra active and at a short notice, that is just 6-7 weeks to go for the paper, I guess, ma'am, at a short notice, they introduced these changes. What is your thought on this?
Yeah, that's very true, Dr. Sushant, and I think all the students have this thing in mind only that it was such an unexpected announcement for them, and nobody was expecting it to be starting from this year. Okay, and can you go back to the first slide, Dr. Sushant? Yeah, so you see what has happened, like all of us, if I keep myself at students position, at your position, friends, so we were studying, like we were engrossed in our preparation. Our targets were clear. Yes, I want this subject in AIIMS, I want this specialty in PGI, or I want to go to NIMHANS, and my all energies were targeted in that way. I had made a schedule for myself. Okay, and then there was this bolt from the blue, isn't it?
It is true. But we can look at it from another viewpoint also.
Yeah, that's what I would like to suggest my students to think it in a way that this is not a totally negative news. It's surprising, but let's try to see the positive side of it. Okay, because that's very important. Whatever has been announced has been announced. Now we have to channelize our energies, not in thinking about it why, but how. Okay, So that is the thing. So the positive things about it, I would say that it has now provided us an opportunity to give a single exam where we can, if we succeed, we will have chance to enter at many institute, and it may be the institute of our choice, which we were wishing at the very first place. And all of these institutes are premium institutes. So, friends, I mean, PGI, JIPMER, AIIMS, yes, each institute has its uniqueness, but nobody will disagree that all of them are the premium institute of our country, where the students they would like to enter and do their post graduation. What do you say, Dr.
So
Sushant?
what sometimes happens is, like, personally speaking, I did not even give the PGI Chandigarh exam. I mean, absolutely no offense, but Chandigarh, the exam pattern was totally different. See, what the government has done is it has clubbed three different patterns. I did not personally give the Chandigarh exam because our seniors told us that PGI Chandigarh requires a different thought process, all possible answers versus AIIMS or NEET, which was the best possible answer. AIIMS and NEET are very closely associated with each other, versus JIPMER paper, where the questions had a slight question mark to them. I mean, the type of questions which came in JIPMER were not usually asked in other papers. NIMHANS was, for the psychiatry people basically, and people. Psychiatry is not a branch that I'm getting surgery, ENT, anesthesia, path, and psychiatry. Let me take psychiatry. People don't take psychiatry like that. People are usually very focused that I want to take psychiatry, then only I'll give the NIMHANS paper. So personally, out of these, I had ended up not giving PGI, JIPMER, and NIMHANS paper. I did not even give those exams when I was there because I was certain I don't want to go into that. What this combined paper has done is a single paper giving more number of seats, more number of options to choose from for the student, firstly. And secondly, जो different varieties के questions थे, ma'am, the different varieties. This was all neurosurgery, neuropathology, neuropsychiatry. I guess we can easily say that the individual hallmarks of each paper will be grossly diluted, and the paper will be set more on the pattern of AIIMS or the NEET exam.
Yeah, that's what we expect. That's what we expect. See, that is what I was saying, that everybody who wanted AIIMS as the target or NIMHANS as the target, they were preparing in that manner, and that is actually the practical impact of this announcement, basically, that how the students are going to prepare now. See, for that we have to now change the strategy to some extent, but still I would say, if we talk about PGI, AIIMS, and JIPMER, but rather PGIs and AIIMS, both were more clinically oriented exams. That was one common thing in them. Okay,
totally agreed.
NIMHANS was a total different game. So the people who were targeting psychiatry, or who were very much oriented that yes, they have to go there, are going to bring more changes in their preparation pattern than the people who were targeting PGI and AIIMS.
Acha, before we go further, I like this feedback from the students. But how many of you were targeting, I'm just starting the poll, only the AIIMS and the NEET with keep PGI plus minus? I mean, paise bhar diye, we have given the money, so let's go and give the paper. Next, NIMHANS. The students who are targeting NIMHANS is always the selected batch. So how many of you were actually targeting NIMHANS? JIPMER, we guys go. So all of the above. All of the above. I am just starting the poll. There is no right answer to this, obviously, but I'll be curious to know the breakup of the students in this. That is actually few technical changes have been made. No, okay. So what I see here is the students targeting PGI and NIMHANS are the least. So for those 7 to 10 students, those of you who are targeting NIMHANS, I mean, a very personal suggestion from both of us, we can safely say that psychiatry questions or psychiatry weightage in the actual paper would be drastically low. So this in a way has streamlined your preparation towards the aims or the NEET pattern. This is the first point. Yes, Kameshwar Bachi, I agree. PGI guide, Kameshwar, you have purchased the PGI guide, but it is not of much use. Not of much use. You can gift it to somebody or whatever. But we'll come to what to do about PGI. NIMHANS, starting with NIMHANS, the psychiatry weightage will be grossly diluted. There is no doubt about that, firstly. What do you think, ma'am? When we talk of PGI, see, AIIMS introduced lots of new pattern questions. It also AIIMS also introduced the match the following, assertion and reason, clinical based long questions from which the clinical histories were given and stuff. We'll come to how to target that, students. Not to worry. It introduced all these and then did away with them in the previous session. If PGI is incorporated with this, if PGI is incorporated, few of these questions will come back, but the weightage will not probably not more than 15 to 20%, not more than 15 to 20%. So this will not be drag decided. What will you suggest? Should the students do that thick PGI book? Will it be beneficial to them?
Yeah, not solely. You're very right, Dr. Sushant. You can't really now do the preparation on based upon a single pattern technique. Like, single pattern is not going to work now. You can't leave yes, very right, psychiatry, which used to have a major chunk of, or the neurosciences, major chunk of NIMHANS. Those people, they have to make the major change. The pattern of the MCQs are going to change, but I would just like to tell again once that AIIMS and PGI, because I had appeared in both. so I can tell you that when I was doing my preparation, the subjects, the topics, the orientation, the mental orientation of the examiner is same. They might ask the question in a different way. True. The more difference was in asking the question in a way that whether all the choices are correct or half, or or the best response. But the topics used to be the same, more clinical based, more management based upon the advances. So I think even in PGI are not going to make much change. That preparation remains the same. The practice of the MCQs needs to be changed. Like, you can't really rely upon the PGI guide. You have to look into the pattern of the AIIMS or NEET. NEET students already do. Nobody relies on the PGI or AIIMS preparation only. Everybody gives NEET, I would say, unless your result is already out before that. So you are preparing for NEET. So that has already given you a practice for how to do the single best response answers. True. So I think PGI AIIMS will be more or less same, except for the practice for the MCQs.
I'll like to add one more point exactly to what you have said here, ma'am. Like, those students who have done pathology, you very well know that one of the favorite topics in pathology, especially endocrinal, pheochromocytoma. Now, NEET or the AIIMS pattern, it asks a question about pheochromocytoma. But somehow in the previous 4 to 5 years, PGI never asked the question on pheochromocytoma. It always went for the extra adrenal pheochromocytomas called as the paragangliomas. So whenever I had a discussion of PGI, I always made sure to discuss paragangliomas, which I never discussed in the NEET or the AIIMS pattern. So the topics will actually remain the same. The depth will increase, and you will just need to incorporate few topics. But personally, as both of us are saying, that it will streamline the preparation slightly better. Streamline it slightly better. So positive aspects, as ma'am said, that if specialty is the priority, the student will have more options. Absolutely no doubt about that, I guess. Prevents the hassle of filling a number of forms, long forms which have to be filled every time. Signature kabhi, signature is this, that, 100 kb, 200 kb, that's crazy. Next point, we need only INI certificate oriented classes. Bache, Kameshwar, you will be having that. Avoid shifting gears. Absolutely no doubt. As ma'am very rightly said, preparation is the same, just the depth will slightly increase. Few favorite topics from each will be added. Avoid shifting gears and do not even think of this, as ki mere saath aisa ho gaya ya waisa ho gaya ya whatsoever, because we can crib about things about which we have a choice. This has been decided by higher ups. We don't have a choice. So we will not be cribbing. We will not be cribbing about that.
And the time is too short. I mean, we can just this whole exercise, even our session is there to make you aware that let's not waste time on thinking why it has been so. Let's strategize that how we are going to take this into our advantage and make our preparation better.
True.
And try that now we have got more options, more targets to achieve actually. Options have definitely increased.
Options are somebody, I mean, how many of you, again, I'm curious, Bache, this is a poll for the students. How many of you did not fill, especially the seniors, did not fill, PGI or NIMHANS exam? Did you fill it? Or let me just put it as a yes, no thing. Did you fill it? Did you fill it? True, false. I mean, there's no right answer to that. Did you fill NIMHANS, the seniors last time? 50% of the students had not even filled. I agree. I was in that category, actually 70%. So
I think up in North India, the I would say preference for NIMHANS is slightly less.
it is less. It is less. I mean, we don't believe in no offense to psychiatrists, but we don't believe in treating crazy patients. But anyways, I'll come to the questions, bache. Firstly, Devranjan, 3-day exam or single day. No doubt about it. It is not next. It will be a single day exam. AIIMS, it believes in keeping the life simple for the students. The questions will be tough and tricky, but it is a single day exam. Next, if next is implemented, then also we will have INI CT or not. So it would be there. It would be there. Though earlier, ma'am, next said that everything will be combined in a single paper. But it is again, I will say that it is good. It is good because the students who are preparing for next will slightly be uncluttered. Instead of making one paper, do or die paper, there would be two papers, next and INI. So I am in favor of this. Frankly, I'm in favor. Next, there was a slightly longer query from Karthik. Karthik, bache, I'll get to your query in the end. Not to worry, I have read your query. It will take me slightly longer time to answer. I'll address it in the end. Manish, ma'am, what's your take on the previous papers? A student has very well asked that we do not give the exam without doing the previous 3-year papers. What's your take on that?
See, again, since the pattern is going to change, though after the 6th October announcement, we are hoping that we will be more sure about the pattern. See, okay? So previous papers, again, take it as a hint for the important topics. Okay, like in ophthalmology, there are hundreds of topics, but for your exam, the preparation should be smart. So which topics you can't just miss. That is what you get an idea from the previous year papers. Okay, because I think never a question is repeated per se. All of us, we have done the previous year papers. The question will not be repeated, but yes, there are certain topics which are repeated. So previous papers haven't lost their importance completely. Okay. We will also, I'm planning in the coming days to come with the classes in which we will make a list of the important topics which can be prepared according to the CET.
Agreed, ma'am. Totally. And one more thing is, by doing the previous papers, especially of the PGI exam, but you do not block your thought process that, it actually alters it, marking all the possible answers, right? So do not block that thought process, but the topics will be very important, no doubt.
Yeah, I would like to add here because this is a very important point because when you have to choose the best answer, you have to your thought process has to be little different. You might find, okay, this choice is also right, this choice is also right. You have to practice that what is the best response.
True.
So I think
And
that needs
sometimes two choices are actually right also in names. They are. We
many times they are. Even we will be like, we have to choose the best response out of two and then explain it. And
True, ma'am. Shweta, if clinical based questions are expected, it's going to be lengthy. No doubt, bache, Shweta, the paper is going to be lengthy. I mean, if length has to go by, even when FMG exam was lengthy, you guys are at much high level. The paper is going to be lengthy, no doubt. Second year, any suggestions, Sai, for second years, bache, second year? Path and pharma will form your basis of almost any paper. So second year, do them well, do the MCQs well, and just combine with 4 chapters from Harrison. That is CVS, lungs, GIT, and liver. I always say this, doing path pharma with these 4 chapters from a reference textbook of Harrison's during second year will give you an integrated thought process and an approach. All the sessions that we are taking on the platform and everything, they are on integrated line only. But as faculties, we can only guide you. Second year is the time when you actually study from the books. This is the time when you develop a habit of reading. So second year will be the most crucial year. It was earlier the honeymoon of MBBS. Now I guess internship will be the honeymoon of MBBS, and second year will be extremely important. Next, Simon, yes, INI Bache will be twice a year. It will be twice. I guess, ma'am, there is no doubt about this point at least.
because AIIMS and PGI were always twice a year, so I think INI is going
The
to be
whole
fun.
cycle of the PG students going out, coming in was twice. So it will be twice. Next, will it kahan bache? It will be twice. Which pattern predominantly will be the AIMS type, Partha? And can we say, ma'am, that the predominant number of questions will also be the single best answer? Like
Yes.
even when AIMS had introduced new pattern of questions, still the predominant one, more than 80% still was single best answers only. So no doubt about that. Next, I guess this gets us to how to do it. Like, ma'am, related to how do we concentrate on university exams in next? What should be primary importance in second year? Shreya, but passing your university exams is of course important, because until and unless the student does not pass the university exam of his or her college, you will not be eligible to go for third year. But if you are doing path pharma well, along with medicine, these 4 subjects, that is, if you're concentrating on next, there is absolutely no way until you commit a major blunder. There is no way you will flunk your second year paper, no? I mean, no doubt, no doubt. Second years, we path pharma, we are cool, calm people. It is the final years and the clinicians. I know ma'am is smiling over this, but nobody flunks second year if you do, until you do something blunderous. So don't worry at that point. Don't worry. Next, ma'am, what is your suggestion for third years? I have numerous queries, Karthik as well as others. What to do with third years? What will
In
you?
third year, from the entrance exam point of view, third year has become like much more important than the previous year, because in the next we are expecting much more weightage to your ophthalmology, to your ENT, PSM. So I think again the third year cannot be taken as lightly. It's going to be as important as the final year, but with more time available at your expense. So you can make those subjects which you are doing in your pre-final or in your third year completely, just like in second year you do an integrated preparation. Here also in your ophtha, ENT, PSM subjects, you do the MCQ, start developing habit of doing MCQ in the third year itself. So I think that is the shift. Don't just rely on make good concept. You have ample time to make good concepts, to read the books, to use the material which is available there from the teachers, and then practice questions at a regular level. at a regular level. All those case scenarios which will you be discussing, because the teachers will be at your dispense to make you understand the clinical scenarios. So I think that is the best time to take advantage of that.
True. And I'll just like to add this, that all the current third years, bache, whether you started studying medicine in second year or not, right now, I guess both of us faculties will not be concerned about that. We'll just like to say one point here: finish medicine. Or when I say finish it to the extent as much as you can. I know COVID-19, everybody's at पढ़ने का मन भी कम है, mom is cooking delicious food and stuff and whatsoever, but try to do as much medicine as you can during the remaining 2 to 3 months. No doubt about it, this will help you a lot. You'll realize the significance of this when you enter final year, and suddenly the students are going to realize that they have to finish not 9 subjects but 19 subjects, because that is what next is going to ask them. And do not have any doubts about it, next one is going to come in March 2022. I mean, no doubt. I guess we are on the same platform.
Absolutely. Rather than being caught unaware, it's better to prepare from this very time only, so that you are much better prepared at that time.
True. And for those who are giving the paper right now, which is fine-tuned to cover the topics, all of us, the educators, we will be giving you the list of topics apart from AIIMS or NEET exam as well. See, AIIMS, NEET, all of us have already given you the list. We will add on to this list, especially me with respect to pathology, PGI, and the topics for NIMHANS. We will do that, though not many questions will come, but you should know the topics that additionally have to be covered. Avoid unidirectional preparation. That is the bottom line. Do not sit with the PGI book. Do not sit with NIMHANS book. Do not sit with the crash course of PGI or NIMHANS or whatsoever and do it for 1-2 months. That would be crazy. At this point, that would be crazy. Study smartly and practice quality MCQs. Practice quality.
That's very important. And as I told earlier also, the concept based, because if you are, the major topics, why do we choose major topics? Because those are the topics where your concepts should be clear. See, ultimately, what MCQ is going to be there. If you are able to apply your concept, definitely you are going to succeed much more. Okay, so preparation, make the preparation, try to understand it. One understanding will help you solving 50 questions. Okay, so that is how it should be. Don't try to just mug up the things. For my subject, I can say, and I think that's true for most of the subjects. Few basic concepts, they just can't be missed. Okay, but at the same time, don't spend 1 hour, 2 hours on one single topic. You have to put more.
It has to be balanced. That is where I guess study smartly.
And when we talk about the clinical based exam, see, it's not that the basic questions will disappear completely. Okay, so I have given international exams also, and many of you have the must have seen those questions. They will start with the clinical statement, but at the end they will be asking the anatomy. So you have to be smart enough that, okay, what is being asked, and you have to link it with that. They might be asking about the pathology and describing the case scenario, and they might be asking you which nerve, or what is the nerve, what is the origin of this muscle which was damaged. So in that way, don't try to leave anatomy and the basic subjects completely. The topics which are important should be studied in integrated.
I agree, ma'am. And I guess lastly, the 3 lines or the 3 words which actually helped me a lot: have a kind heart. So, wanting bad things to happen to others has never made us successful. If we have to surpass somebody, we will have to up our game. Have a kind heart, a fierce mind. You should have this, this zeal in you that yes, I will be able to do it. Shreya, that is what I guess you asked also, that in the COVID-19 situation, not only you. Let me rephrase this as more than 80% students are performing at less than their caliber, especially those who are currently in second year and third year. There is no doubt about it. I mean, we have full faith on your caliber because there are so many factors. You are at home, the food is there, you do not have a separate room, there's surrounding noise. friends are not there, it gets boring. More than 80% students are performing at less than their caliber, but that is where the fierce mind will come in, and a brave heart to take care of all the changes that the examiners will introduce in their paper. So I guess we can wrap up the session at this point, ma'am. And one student had asked actually a slightly longer query. Karthik, Bache, this is for you. This is for you. If somebody has given next one already, he is not satisfied with his rank, and he is repeating it again. He will be doing it before internship. Firstly, secondly, somebody gave next one, was not satisfied with his rank, but he wanted to get into internship so that he can start earning. He did internship, passed next two. Fair enough. When you give the paper again for the PG seat, you will only and only be giving next one and not next two again. It will be the next one which will be the deciding paper for the PG seat. For the PG seat. Karthik, that was for you. Karthik, and that was for you. Ma'am, last few words and then we wrap up.
So that's true. I think the brave spirit is going to help us make this bolt from blue into the shining light. Okay. So I think each one of you, beta, each one of you who is listening to us or who will be listening to us are listening to us because I know you people are oriented towards your goal. You have that dedication that you can overcome these minor obstacles. Okay. So please believe me, try to take these changes as minor obstacles, try to form your path around it, and let's make this bolt from the blue as a silver lining. Success is going to be yours. You were preparing for AIIMS or you were preparing for PGI, you had that determination in the mind, and I think that determination will definitely result in success. And we are with you.
We are with you. Strong words, but we mean it. We are with you. You guys will do well. You guys will do well. And Karthik, Bache, the nitty gritties, let the paper come. We are talking of 2023 with, I reread your question, 2023 with two people with the same score, something or the other will be done about it. Let's not worry about 2023 at this point. Done, Bache, done. Let's think of preparation and go further. Done. Yeah. And a pleasure for, thanks for sharing the platform with me in the same session.
Yeah, so I think as soon as any further announcement is available with us as regard the pattern, so we will definitely guide you better in all the respects, right?
True, ma'am. Take care all the students, and thank you, ma'am. Have a nice, wonderful evening.
Yeah, all the best to all of you.